All right, good day, everyone, and welcome. Heartfelt thank you to everyone who's joining us today. I am Nicole Jackson, the Director of Education with Center for Engagement, Environmental Justice, and Health, better known as CEEJH. It is my honor to welcome you today to join our cohort of Climate Justice Fellows as they present their final assignments. Starting in 2023, the Climate Justice Fellows Program is a virtual training and implementation program designed to educate individuals on essential themes and tenets of environmental and climate justice. Candidates demonstrate a commitment to environmental justice issues and have deep connections to frontline and fence-line communities, better known as EJ communities. Fellows increase their awareness of environmental and climate issues, as well as develop skills to empower their own communities affected by environmental injustices. The fellowship program consists of individuals who progress through an intense curriculum with 10 to 13 targeted modules and capstone projects addressing environmental and climate justice challenges. With our senior fellows, who we select from previous cohorts, expanding on their projects, delivering presentations, conducting research, writing, and or working directly and closely with CEEJH staff. Excuse me. Having formerly served as a fellow in the first cohort and a senior fellow in the second cohort, this year, I am proud to have redesigned the program to be more practical and global oriented, as well as include a few new modules. As a core part of this new approach, everything is centered on real-world applications that we at CEEJH call empowerment science frameworks. Empowerment, spelled INPOWERMENT, empowerment science includes community-based participatory research, citizen science, community-owned and managed research principles, and the collaborative problem-solving model with a focus on equitable planning, healthy zoning, and sustainable community development. Throughout the program, fellows engage with assignments rooted in actual case studies and were consistently encouraged to adapt and tailor the work to the specific needs and context within their own communities. This philosophy culminates in a final assignment, which you'll see today. In a significant shift from previous years, we challenged our fellows to proactively propose and develop their own initiatives, moving beyond traditional capstone projects. But their learning wasn't theoretical. They rolled up their sleeves and dove into technical work alongside some of our CEEJH staff on current projects, from policy analysis and air quality monitoring to developing educational content for our symposium. Excuse me. This practical-based model was implemented on a unprecedented scale, making the first time we expanded the fellowship across our global network. We were thrilled to welcome a diverse cohort from across 16 different countries. This diversity has been profoundly enriching, and it helps us to enrich our discussions, broaden our understanding of how we are all connected and how environmental impacts affect our communities in immeasurable yet connected ways across the globe. If you are interested in applying for next year's cohort, please contact us at fellows@ceej.org. That's fellows@ceejh.org. Applications will open this month, and we'll be sure to forward an application to you. Additionally, we'll have two information sessions about the Climate Justice Fellows Program, one on November 10th at 12 noon Eastern Standard Time, and one on December 15th at 7 p.m. Eastern Standard Time. The presentations you are about to see are a testament to the Fellows' dedication, creativity, and global perspectives. I'm going to ask you to keep all of your questions until each fellow has presented, but feel free to put questions in the Q&A box for any of our fellows to respond to at the end. And now it is my pleasure to introduce our fellows for today, Mariam Mauzi and Stephanie Cooper. Mariam is based in Toronto, Canada, and uses she, her pronouns with over a decade of hands-on experience in the realm of education, organizational development and management, total quality management, and accreditation. She has had the privilege of contributing to both academic and service organizations. Her adeptness in strategic planning and decision-making has been continually sharpened over the years. Furthermore, as a senior seasoned lecturer for the service administration and hospital administration programs, Mariam has effectively shared her expertise with university students. Mariam has a track record of conducting meticulous audits and curating plans for continuous improvement aimed at organizational excellence programs and the accreditation process. Additionally, she possesses a robust report writing abilities with expertise in crafting official documents and workshop materials in both Arabic and English. Excuse me. Mariam holds a master's in adult education from KwaZulu-Natal University in South Africa, and change management post-degree certificate from University of Toronto in Canada, and a BS in nursing sciences, a BS in nursing science from American University of Beirut, Lebanon. So without further ado, please help me welcome Mariam. Mariam, you're on mute.
Hello, Nicole and colleagues. It's a pleasure for me to be presenting today my final assignment, and it is on the 6-month campaign planning for health issues resulting from the wildfires in Canada, and mainly the Manitoba Indigenous population. Can I share now my slides?
Yes, you can share your slides.
خليني أفكر. لتحت. وين؟ مم. مم. Yeah, okay.
Mariam, we can see your
Yes,
screen, but
yes.
we cannot see you.
جاد ما عم بيشوف، ما عم بيشوفوني ولا عم بيشوفوا. طيب بس بدي أعمل هذا إنه يشوفوني.
All right. When you're ready, Mariam, please.
Yeah.
Yeah, please begin.
Can you see my slides?
Yes, we can see your slides. We're ready for you to begin.
Okay. Okay. So this is my 6-month campaign plan for Manitoba area. There is a saying from one of the Indigenous people. It says, when the environment is destroyed, you are destroyed. So what's the problem? I will tackle in this presentation the wildfires and the air quality pollution that is causing many issues on the Indigenous. And I will I will use two principles or guides in my assessment phase, and the planning and the checking and the evaluation. So I will use the medicine wheel illustrating the 4 aspects of an individual health. It's the physical in the black color, the spiritual in the red, and the emotional in the yellow, and mental in white. And I'm just using this figure for the research, and that includes all the concepts of health as related to Indigenous population communities. As well, I will make use of the Deming Cycle, Plan, Do, Check, Act, in order to plan for my campaign. What is the problem? The problem is that we have wildfires in Canada, and it causes air pollution and affects the health of the communities in Manitoba mainly. In 2025, the Canadian wildfire season began with over 160 wildfires across Canada in mid-May 2025, primarily in Manitoba, Ontario, and Saskatchewan, and declared many emergencies. And even these wildfires spread through the Atlantic Ocean to states, to the Europe countries. The total fires were 5,349 as of 16 September 2025, and the total area exposed was 21.7 million acres. And there has been 68 and 800 people evacuated because of the wildfires, and there are structures destroyed of 631. The human, I will concentrate and focus on the human impacts that they were impacted by the wildfires, and it caused direct threat like burns, mass displacement, destruction of homes, and severe health risks. The health impact was directly on the burns, skin burns, and the mass displacement and destruction of homes. The air pollution impacted the health, causing skin burns, respiratory issues like asthma and bronchitis, cancers, cardiovascular problems, including heart attacks and stroke, and neurological effects such as Parkinson's disease and Alzheimer's disease. As well, it caused premature death, birth defects, and eye irritation. The vulnerable communities were the indigenous people who were close by location to the fire-prone regions, and they have limited resources and limited infrastructure, hindering their ability to respond effectively to wildfires. Also, the loss of their houses, their income, and they had to rely more on external sources and support. And this impacted as well the land and the sea and the water, thus impacting the hunting and fishing, food security, and cultural practices of the indigenous people, and caused intergenerational trauma and mental health effects. So this 6-month health campaign plan is guided by the collaborative cooperation and partnership with the First Nations, Métis, and Inuit leadership, focusing on holistic health, cultural safety, and self-determination, as well as aligning with existing health transformation initiative and the Southern Chiefs Organization's themes. One of the themes is food is medicine, for example, and leveraging the existing health organizations for delivery and evaluation within 6-month time frame. The collaborative team, and I don't use the stakeholder because a stakeholder has a colonial connotation and term with the, it's not a good term to be used with the indigenous people. So I will use the collaborative team, who are from people, grassroots actors, environmental champions, vulnerable population, the children, seniors, the indigenous people, and those with existing health conditions who were affected from the air pollution, and who have also socioeconomic factors like poverty and lack of resources. As well as this team will be utilizing and partnering with academics and scientists and the faith communities and the local government and the non-profit organizations. So in the cycle, it says the first phase is planning. And to do planning, I will use the assessment. And the assessment, I took it in two directions. One by SWOT analysis, and the other one is data analysis and review of existing programs and policies. So the goal one for the assessment is to do the assessment. The objective is to identify the vulnerable communities and disparities and health needs. And the second objective is to map the exposure, the hotspots, where is the need for an action to be implemented, and to also expose and identify the health burdens, because we said that there are many diseases and many health issues resulting from the poor air quality. We come to the next step, which is the plan and do phase. I have 3 goals. First goal is to target interventions and awareness of the public, because education is very essential in this campaign. We have to do public education and communication, And in the terms of the communication is, I will focus on, having interpreters so that the indigenous communities will understand the message properly and can contribute to the communication. And communication doesn't mean that they have to be listeners. They are partners in this part of the education. And also there is a training phase so that we build sustainability of this campaign to be continued after the 6 months. Also, we need to focus on community-based solutions to decrease the air pollution impact, as use of some sensors, some air purifiers, staying at home, handling the fires, or and cooperating with the municipalities there to prevent the impacts of the fires. The goal too is advocacy and policy change. We will review the policies and the acts, and we will recommend policies as needed. And the second objective is the urban planning integration, for example, to increase the green spaces around them in order to purify the air quality, and also to take care of their houses um, um, for as using of air purifiers, for example. The goal 3 is the use of technology and monitoring integration. The use of technology, that is to use, for example, for communication, for media, and the monitoring is to use the tools and alerts for air quality. We continue with the plan and do phase. It is to expand the monitoring networks and air quality forecasts. After we do the implementation and during the implementation phase, we need always to monitor and check and update our information and our implementation activities. For the check and act, we have the objective one is to track key metrics for the campaign outcomes. It's I use this term from the quality management. Whatever you can measure, you can improve. So we needed to track the key metrics to monitor changes in the community, such as health outcomes, it is improved or not, the pollution levels decreased or not, the public awareness, these metrics. The objective is to regularly reassess and monitor and evaluate and modify accordingly. For example, in some of the steps in the plan, one activity didn't work well. We have to improve it, modify it, evaluate it, so that we have a continuous monitoring and evaluation system to track progress and make necessary modifications for all activities, and track the outcomes, and always keep documents updated to do reassessment, to adjust strategies and ensure the campaign effectively reduces the health disparities and issues. And after we do the evaluation, there is improvement plan. We have to set an improvement plan in order to continue this campaign and to be sustainable. For every campaign, there is a need of a fund, and this fund is estimated to be 500,000. It will be distributed in the way of team and operations, 35%, marketing and media, 15%, content creation, 20%, and community meetings, conferences, health fairs, presentations, 15%, technology and data, 10%. And for any, contingency plans, 5%. So to conclude, this is a 6-month health campaign plan to be developed collaboratively with Indigenous communities to focus on holistic health approach, cultural safety, and self-determination. And the steps were to assess and identify the health issues and the needs and align the campaign with the existing programs and do the planning and implementation and then the evaluation step. Thank you.
Thank you so much, Mariam, for sharing. That you did a great job. So really quickly, before I ask some specific questions about your assignment, do you mind sharing a little bit about the resources that you use to conduct your research and to help develop the assignment?
Yes, I forgot to put in my references, but I used one report which is on Manitoba air quality, and one from Ontario, and one from, I will send by email. Is it okay?
If you could simply add the references to,
To the presentation?
yes, to the
Okay,
presentation
I will
and
do.
yep, and re-upload it, that would be great. Before I ask any questions, I see Samia has joined us. Samia, do you have any questions for Mary?
No, I don't. I think the presentation was very clear and and very well explained.
Thank you, Samia. So, Miriam, I do have a couple of questions for you. Excuse me. And one is about balancing, excuse me, about balancing immediate action with long-term change. So your campaign addresses both immediate needs, like emergency shelters and air filters, and long-term goals like policy change. Given that you set a 6-month time frame, where do you see the most critical point of leverage for this particular project? And is the primary goal of the campaign to demonstrate a model for immediate relief that can be scaled, or is it to lay the groundwork for something longer term in terms of policy?
Yeah. It's both to meet the short-term goals, which is the immediate care, and the long-term is that I want to build a team who is able to carry on after this campaign is over, and they will be empowered with the knowledge and the skills to continue. Because, if we work only on short term, by the end of the 6 months, the benefit will be vanishing and they will start from 0 point. That's why I take into consideration what programs are existing and I will build on it, or and I will build. I will try to empower the team, the collaborative team, to be continuing the activities even if the campaign is over.
Thank you. That's great. I have another question. So I love that you actually centered Indigenous collaboration as one of the core principles. So could you elaborate a little bit on the specific process you'll use for ensuring how collaboration will be truly equitable? So for instance, how will you structure the decision making um, with the collaborative team to ensure the partnership is, uh, rather than a consultancy, how would you budget to compensate Indigenous leaders and knowledge keepers for their time and expertise?
In terms of collaborative team, this team will be, will have the power and the complete partnership in the decision making and reviewing from the start to the end. It's not only a listening session, and I don't believe in listening sessions. I believe in partnership, in equal participation and engagement of the collaborative team. Did I answer or?
No, you did. You answered perfectly. Those are great. Um, those are the biggest questions that I had. I just wanted to ask you a few. I do have some other questions for you, but they specifically relate to the assignment that you turned in. So what I will do is add a few comments to your assignment, which I think was wonderful. But I will say, just to give you a heads up, I want to ask more about the budget justification categories and make sure that the amounts are able to help strengthen your proposal. And then I wanted to clarify if any of the amount of the budget that you presented would be allocated directly to Indigenous partners for leading any of the initiatives that you have related to the campaign.
Yeah. Just to say that this is theoretical because I don't have hands-on with the communities there, and I come only from healthcare background, and but I am a fellow client of CEEJH, so I tried my best.
No, you did excellent. So one of the things that I did want to ask about is, did you think about, even though theoretical, did you also think about um, what the success metrics would be in terms of how you would see the projects as being successful? Did you take into account any of those things?
Yeah, in the SWOT analysis, I made just, a concise thing of SWOT analysis. There was many obstacles. The obstacle is the language barriers. There are 14 language in that area for the indigenous people. That's why there is a need of interpreters. The access to care is such a complicated system for them. And it's not, so they have this obstacle. It is a weakness. And but what's encouraging is that there are programs that was initiated and led by the indigenous communities. And this is a kind of strength to my campaign.
Excellent. Thank you so much. I really appreciate you taking the time to share with us today. And we did hear from, I heard from the other fellow that was supposed to join us today. She had a family emergency, so we will see her presentation at another time. I do want to thank you again. Thanks, Mia, for
Thank
joining
you.
us. And thank those of us that are will be watching the recording. We really appreciate you. Just a reminder, if you're interested in joining next year's Climate Justice Fellows cohort, please reach out to us at fellows@ceejh.org. And that is our time today. Thank you so much.
Thank you. Thank you.